Hi, my name is Aaron. I'll be the nurse practitioner speaking with you today. I hope you found the office okay.
Yeah, it was easy game.
All right, good. So I'm a nurse practitioner. So what that means is I'm going to be asking you a few questions, get to know you a little bit better, see what's been going on with your life, and see what options we have moving forward. Before we begin the interview, it might be a little bit of time that I take from you. Can I offer you some water, or do you need to go to the restroom before we begin?
No, no, no.
All right. Through the interview, I'll be taking some notes just to keep my thoughts together. And whatever you say, I want to make sure to write down everything that's important. So I will be taking some notes during this interview. Okay. First, I want to ask, what brings you in today?
Well, I don't know. I've been thinking about it for a while, and just sad all the time.
Okay. Well, I want to thank you for coming in today to speak with me. I appreciate that. When you say you're sad all the time, could you explain that a little bit more?
I don't know. I just noticed that some time ago, after I guess like maybe a year or so ago, after my girlfriend left me, I just hadn't dated anybody else, and just I don't want to do anything. I don't want to see my friends. I don't know. I'm not enjoying life like I used to.
Okay. Are you finding it hard to get out of the house?
Sometimes, I mean, I go to work, but I don't really see my friends, and I don't really make many efforts to go out and meet new people.
Okay. So you said about a year ago after your girlfriend left, you started having a hard time hanging out with people and enjoying some things, and that's leading to you feeling down lately.
Yeah, pretty much. I feel like it's worse this last couple months, maybe. I don't know if it's just because it's winter and it's cold. I don't go outside much, but yeah.
All right. There's definitely some things that we're going to touch on either today in this interview or a little bit later so we can explore some options for you, okay? Um, has this ever happened to you before?
Maybe I don't know, like in college, maybe for a little while, but it's hard to tell because I don't know. I was living in a dorm and like had people, around me all the time. So I don't know,
Okay.
maybe.
Were you experiencing a lot of stress while you were in college or when these feelings were happening?
Yeah, colleges. I mean, I took a lot of hard courses, so yeah, it was yeah, probably stress with school.
Okay. You had a lot of stress in school and college, and these sad feelings kind of came on that are similar to the ones that you're telling me about now that happened a year ago. Well,
Similar,
with your
but I'd
girlfriend
say
leaving.
it's worse now.
It's worse now. Okay. All right. Now, have you ever been diagnosed with a psychiatric illness before, a mental illness,
No,
depression, anxiety, schizophrenia?
no,
No. Have you ever had a psychiatric hospitalization?
no.
Okay. Have you ever been hospitalized for a medical reason?
You mean like stay overnight or just in the hospital at all?
Let's say in the hospital at all.
Yeah, I had my tonsils taken
Okay. Do you remember when that was?
out. I was like a little kid.
Okay. Everything go okay?
Yeah.
Good. 10 years old. Do you have any diagnoses currently that I need to know about? Anything like hypertension, high blood pressure, or
I was told by my doctor like a couple years ago that I should watch my cholesterol and that my blood sugar was kind of high. My what's that thing you guys call it? Like your A something for your blood sugar, a one
your
something.
hemoglobin A1C?
Yeah, yeah,
Okay.
yeah. I was told I need to like watch that, but I never went back to that doctor. It's been like a couple of years. I don't really like going to doctors, so I don't know how that is
Okay.
anymore.
So it's been a couple of years since you've seen the doctor, but did he prescribe you any medications for it?
He said maybe I should take something, but like I said, I never really went back, so I don't know. I
Okay.
wasn't taking anything. I didn't get a prescription filled.
Did you adjust your diet?
Not
Did
really.
they tell you how to adjust your diet or anything?
He wanted to, but I didn't really care at the time. I said, don't worry about it. So,
Okay. And I just want to go back and touch on this again. Are you taking any medications currently, either prescribed to you or over the counter?
like I take some to help me sleep just about every night. I take like whatever Tylenol PM or something like that.
Okay.
So I usually can't sleep without that.
You take one or two of those.
I think I take more than I'm supposed to. I think the bottle says take one, but I take two anyway.
Okay. How long have you been taking that?
Like probably since I broke up with my girlfriend a couple years, like a year ago.
Okay. Have you been having any side effects? Have you been drowsy lately?
Not maybe when I first started taking it in the morning, I'd be more tired than usual, but I think I'm so used to taking it, it doesn't really affect me. So that's why I started taking two because one wasn't helping me out well.
And it's not as effective anymore as a year ago.
Yeah.
Okay. Let's see. Have you ever taken any medication by the name of Prozac,
No.
Zoloft?
No.
What about Celexa?
No.
Let's see. Now, I want to make sure that you know this is a safe environment, and I'm asking you these questions not to make you uncomfortable, even though they can make you a little bit uncomfortable. I just need to know a little bit more about you to get to know you a little bit better, to kind of have a deeper peek into what's going on. Okay? Were you ever abused, or are you being currently abused?
No.
No, physically or emotionally?
No. I'd say I grew up with parents who were, they were strict, but I don't think they were abusive.
Did they ever yell at you for no reason, or did they ever put their hands on you?
I don't know. We got things like some of the, like my friends and cousins and stuff got, like but nothing where I felt like it was abusive. But
Mm. Were you ever scared of your parents or felt threatened by them?
not really.
Okay. Let's see. Have you ever been involved in any kind of violence?
I got in a fight with a kid back in middle school, but we just kind of pushed each other against the lockers, but not like anything major.
Okay. And nothing recent?
No.
Okay. Have you ever witnessed any accidents or like someone maybe being murdered or a car accident? Have you ever witnessed anything like that?
Not really. I've had friends who went through stuff, but not me.
Okay. You've never witnessed it personally?
No.
Okay. Let's see. Did you ever feel neglected as a child?
No.
No? Your parents, were they a good support system?
Yeah, they were always around. They still are and call for things if I need to.
That's good. It sounds like do you and your parents have a good relationship?
Yeah, we see them. I live kind of far away, but I still try to get up there and see them every 2 weeks.
Okay, where do they live at?
They live back in South Carolina.
All right. And you try to make it up there whenever you can to see them?
Yeah, they'll come and see me too. So just depends on our work schedules and stuff.
Good. All right. The next question can be a little hard to talk about, but again, this is for your safety. I just want to make sure that everything in your life is going okay and trying to decide what we need to talk about later in the interview. Have you ever, or do you feel like harming yourself?
Not like right now, but I've had, I've thought about it before.
All right. So would you say that the thoughts come and go, or do they stay with you?
Um, when they happen, they kind of stick around for like a few hours or that day or that night. Depends on if I've had a bad day at work or something, I guess. And then, like, maybe the next day they're gone. I might, just try to sleep it off or something.
All right. When these thoughts come, do you ever have a plan of harming yourself?
Yeah, I've thought about, like, I don't know, I wouldn't do it, but I thought, like, maybe I would take a bottle of pills or something. Like,
Have you ever tried to kill yourself before?
no, I've never done it, never tried. Just, like, sometimes it just pops up when I get really sad.
Okay. So currently, sitting in our office, are you having any thoughts about harming yourself today? Did you have any thoughts about harming yourself?
No, only because we're talking about it now, but not really.
Okay. All right. So these thoughts can be very serious, and I want you to feel comfortable enough to call me, especially when you start thinking about harming yourself, so that you have some support. At the end of our session, I'm going to give you some support numbers to call. The National Suicide Hotline is a very good hotline to call. They're 24/7 national service hotline that are always open and willing to talk to people.
Okay.
Okay. I'll also give you some immediate resources like the local hospital and of course 911. All right, whenever those thoughts do occur. Do you have any family members that have harmed themselves or have tried to commit suicide?
I had an uncle who I didn't really know him, but an uncle that shot himself. My dad told me about it like before I was born.
Okay. Any other family members?
I don't think so.
Okay. Do you participate in what's called self-harm? Do you maybe cut yourself
No,
or injure yourself in any way to deal with emotional pain?
no, I'm not. I'm not like this.
Not like those people. So you don't cope like that?
I've heard about people who cut themselves. I don't know. I wouldn't do that.
Okay. Let's go to your medical history. Do you have, besides you talked about having some high blood sugar maybe and some high cholesterol maybe. Is there anything else that you've discussed with a doctor before about your medical history that you know of right now?
I don't think so, but like I said, I don't really go to the doctor, so I don't know. It's been a few years. They didn't really, aside from those things, didn't really recommend too much else. I could probably stand to lose some weight, because I've been depressed. I've been eating more and just not really going to the gym or anything. So I don't know. I probably am overweight right now, but other than that, like I don't know.
Okay. And besides your tonsillectomy or getting your tonsils removed, have you ever had any other surgeries?
No.
No. Okay. Are you allergic to any medications or any food that I need to know of?
Um, allergic? Um, not really. There were some things when I was a kid that my mom told me I was allergic to, but I eat now. It doesn't matter.
Okay. Have you ever had an allergic reaction where your tongue swelled up or you felt like you couldn't breathe
No,
or developed any hives or rashes?
nothing like that.
Okay. And you said the last time you saw a doctor or a nurse practitioner was a couple years ago.
No. Yeah.
Okay. Did you have a reason to visit them or were you just following up?
No, I just went because I feel like it had been a long time and I actually was motivated. I had good insurance at the time, so I went ahead and just went.
Okay. Are there any barriers to going to see a family doctor now?
Just get myself motivated, really. I have okay insurance right now. My employer. I don't know. Haven't felt like going.
Okay.
I'm kind of afraid maybe that we're gonna find something if I'm being honest.
All right. We'll unpack some of those feelings a little bit later in the session, okay? Or maybe a
Okay.
little bit later down the road. Have you ever had a head injury? Have you ever hit your head on something and had been diagnosed with a maybe like a brain injury?
Uh, not been diagnosed. I was in a car wreck when I was like 16. Um, I don't think I hit my head or anything, but it all happened so quickly. I don't know. I didn't go to the hospital or anything.
Okay. Do you remember losing consciousness?
I don't think so. It all happened so fast. Maybe if I did, it was like a split second, but I don't think so.
Okay. Do you have you ever experienced any seizures?
That's like where your tongue rolls back in your mouth.
Kinda. It can be a little bit different for everyone, but usually it involves where you kind of lose yourself a little bit, lose consciousness, and maybe you can end up on the floor. Where in movies and TV shows, they kind of jerk back and forth, their body loses control.
Okay.
That's
No, I've never done
okay. All right. The next section is important to talk about because it's important for your health. And like I said, this is a non-judgmental environment, so I want you to try to be as honest as you can with me. Do you, what amount of alcohol would you say you drink per week?
that. I probably have like a couple beers a night, maybe, and then it hasn't been. I don't really go out with my friends that much anymore, but sometimes if I go out with people, I might drink, 4 or 5 in a night if you go out like for a party or something, I guess.
So on the weekdays, you would say about 4 beers on Saturday and Sunday, or Friday and Saturday on the weeknights.
Yeah, maybe that much,
Okay. And then about two beers a night on the weekday. So like when you come home from Monday, you would have 2 beers at night.
probably, yeah, because I take those, like, I take my sleeping medication usually right after I finish my last beer. I feel like it kind of helps me get to sleep.
Okay. What about on the weekend days? Do you partake any alcohol on the day part of the weekend?
Yeah, sometimes I'll, after breakfast, lunchtime, whatever. If I'm not doing anything else, I'll just have one while I'm watching TV or whatever.
Okay. So would you say 1 beer, 2 beers?
All day or just
Just in the daytime.
yeah, probably a couple.
Okay. All right. So let's see. Let's add this at 10. All right. So roughly around 20 to 22 beers. What type of beer are you drinking? Is it the like a 24 pack where you get a little can, or would you say the 40 ounces,
No, it's just
cans of bottles? Okay. So we have what's called recommended amounts to drink. Okay, you're now leaning on the high risk side with the amount you drink. It's actually, and a lot of people are unaware of this, there's a recommended amount that we drink throughout the week, or and it's usually 2 drinks per day, and not totaling more than 14 per week. Like I said, a lot of people don't know it and they're just unaware. Would you be open to trying to move yourself from the high risk to the low risk?
if it helps me, yeah. Probably like I said, some of the weight gain and stuff too. It probably goes along with that. I just, I'm not motivated to change a lot right now. But if it helps me get better, then yeah, I can, we'll try.
All right, great. I can also give you some education on this. The reason I ask is from moving you to the high risk to low risk. What I mean by high risk is that we're finding that alcohol can cause a lot of cancers. So for men, we can do colon cancer, pancreatic problems, pancreatic cancer, stomach cancer. So we really want to decrease those risks by decreasing the amount of alcohol to consume. All right, so I'll give you some more education about that, and we'll talk about that a little bit later too, okay? Let's see. Do you use any prescription drugs at home, like opiates, benzodiazepines?
No, I don't think
No. Do you get any street drugs?
no. Like every now and then, you know, I used to have friends that I would smoke some marijuana with, but it's been probably over a year now, or maybe like just a couple months after my girlfriend and I broke up. Like, I was still kind of hanging out with my friends more.
Mm-hmm.
Get together and smoke a little, but I haven't really done that in a long time.
It's been about a year since you stopped using marijuana.
Yeah.
Okay. Let's see. Do you take like Vyvanse or Adderall?
No.
No. Okay. I want to ask a little bit about your family history. Can you tell me any medical problems that maybe your mother has, if she's been diagnosed with anything?
My mom, she's diabetic. I think she did it because she got overweight and it was probably like after she had me and my sisters. Um, but she has diabetes and then like she has that numbness in her legs, whatever that's neuro something.
Okay, some neuropathy from the diabetes.
Yeah,
That's
yeah,
awful.
that. Um, Other than that, she's kind of like I said, she's overweight, but no heart problems or cancer or anything.
Mhm. What about any psychiatric history? Um,
I don't know. I kind of always wondered if maybe she had something, but I don't think she's ever been like to a doctor for it.
can you describe what you mean?
Uh, like when we were kids, I feel like she would get sad sometimes. Like we would ask her to do things, and she just wouldn't want to. like deal with us, I guess. So she would tell us to go hang out with our friends.
Okay. On your next visit, I'm going to do what's called a family genogram so we can really explore a little bit more about your mom.
Okay.
All right. Does she have any substance abuse history? Does she use any prescription drugs or abuse alcohol?
I don't think so. I've never noticed her.
You didn't notice.
No.
You didn't see that. Okay, that's fine. What about your father? Did he have any mental health history? Was he diagnosed with any mental illnesses?
Mm-mm.
No. All right. What about substance abuse? So excessive drinking or any prescription drug use like pain pills?
I don't like. Neither of them are really like diagnosed with much, but really he probably has a drinking problem. He drinks, kind of like I do, like at least like, probably more than me, like 4 or 5 cans of beer when he gets home from work. And he'll just drink all night until he goes to sleep. So like it's not a problem though, because he still works and he and my mom still get along, and they still go out with their friends and stuff. But he probably just drinks too much.
Okay. All right. Let's move on. Let's see. We're going to talk about a little bit more about you. So, about how your mom was when she went into labor and when she birthed you. Were you delivered, vaginally, or did she have a C-section?
I think normal. I don't think she had C-section.
Nothing was wrong with the like birthing process. You didn't have to stay in the hospital as a child, as a little baby, or she didn't have to stay in the hospital.
I don't think so. I never heard about that.
Okay. What about childhood? Did you have a good childhood growing up? Were you how were you in school?
Yeah, it was pretty normal. I didn't get like really good grades or anything, but I didn't flunk any class, never held back or anything. I played sports and stuff, and I was good at that. But pretty average.
Okay. Did you make some good friends in school?
Yeah, I had a bunch of my buddies back in school, and some of them I even still talk to.
Mm-hmm. What's your did you finish high school?
Yeah,
Mhm. Did you go to college?
I went to most of college, but I actually never finished. I got up to like my senior year, and then I just ended up. That's when I started. I came home that summer. I had to like stop a class and put things on hold, and I just never really went back. I started working, at the factory back here at home, and just that's kind of where I'm at right now.
Okay. I what happened at the last semester? You said you had to come back.
I just wasn't making good grades. I was probably like partying a little bit too much. I don't know. Like I just didn't feel like doing the schoolwork, and some of the courses I was taking I thought were kind of bullshit. So I just couldn't see sense in going into class some days, and then rather than flunking out, I just dropped out.
Okay.
But I'm probably gonna go back at some point and finish up my degree. I don't know. I just haven't felt like it yet.
Great. What was your degree going to be in?
Um, well, I declared my major in biology, but um, I don't know, like midway through, I just kind of felt like changing things up, and I was even considering maybe doing something in like engineering. I don't know.
Are you still working at the factory?
Yeah,
That would coincide with your work wonderfully.
yeah, where that was headed.
How long have you been working at the factory?
I guess about 3 years now.
Are you enjoying your job?
It's okay. I mean, I'm like an assistant manager now. I got promoted from when I first started on the floor, so and it can be stressful some days. It's okay.
All right, that's great. Um, you said you're still involved with your family. What about your friends? Are they still involved with you even though you don't go out with them as much?
They probably are kind of tired of. I don't know. I don't hear from them as much. They'll ask me to go hang out and stuff, but I probably been ignoring them so much they don't feel like asking me to go things because I say no all the time.
Okay. All right. So I asked about your mother and your father and about their history with mental health and with their substance abuse. I want to talk about your mother's mother. Can you tell me about her? About
Yeah,
her mental illness, or if she was ever diagnosed with mental illness or substance abuse?
I don't think so. She was pretty normal as my, um, I don't know, my mom seemed to have like an okay childhood. They grew up pretty poor. And I think my grandma did a lot to try and make sure they had a pretty normal, you know, upbringing.
Did you have a good relationship with her?
Yeah, I don't. My grandma she died a few years ago, but we would go see her, for Christmas and stuff, whatever. And growing up, we would go to her house a lot, and she'd always cook meals and stuff, and we would just hang out there. My mom and her visited.
So, to your knowledge, you don't know of any mental health issues or any substance abuse issues like alcohol or.
I don't think so. She was pretty like Christian, and she would, she went to church every. She was, like she was. I don't think she would like drinking like that.
Do you have any aunts or uncles on your mom's side?
Yeah, she had one brother, and then she had an older like half sister from another marriage or something. I didn't really know
I know. And tell me a little bit more about this uncle.
her. She was younger than my, or he was younger than my mom, and she kind of helped raise him a little bit because she was a few years older. But he works off in somewhere out west, like I don't know, Arizona or New Mexico, somewhere like that. I don't really see him as much anymore. We saw him a few times we were growing up. He'd come visit, but I don't really know him that well.
Okay. And as far as you know, does he have any mental health issues or any problems with alcohol or prescription drugs?
I don't think so, but we don't really hear from him anymore. So maybe at this point, I don't know.
All right, that's fine. Let's see. And what about your mom's dad?
He died when my mom was growing up, so I didn't know him.
Mhm. Any mental health issues or substance abuse that your grandma
He
maybe
was,
said or your mom?
I don't know. They were working class. He probably drank a lot too. That's probably why my grandma didn't like drinking.
Hmm. Was there any tension in the family?
Not that I know of. My mom never talked about it.
All right. So what about your father's mother?
She's pretty normal
Mhm.
too. I mean, we see her. We would see her more growing up. We lived closer to her. We'd spend a lot of time there. It's pretty normal household.
Any mental health or substance abuse issues?
No, not with her. She would drink, but just like occasionally at like cookouts and stuff.
Okay. And nothing diagnosed though.
Not that I know
What about your father's father?
of. Probably a lot like my dad. Probably just drinks too much. Pack a beer every couple of days. I guess like 12 pack. I'd go through every night, drinking 5, 6 cans or bottles, whatever he had. Until get home from work, have a couple of dinner, and then sit there watching TV for the rest of the night, whatever,
Okay.
drinking beers.
Was he ever diagnosed with any mental health issues? Depression, anxiety, schizophrenia?
Mm-mm.
No? Do you have any uncles or aunts on your father's side?
Just the uncle who killed himself.
Okay. Do you know how old he was when that happened?
He was probably in his late 20s.
Awful. I'm so sorry to hear that.
Sorry, I didn't really know him.
Do you know if he had any mental health issues or any substance abuse issues?
He probably did. My dad would talk about how he would do cocaine and stuff, and like he was just kind of a wild child, like growing up. He would get in trouble at school a lot, and like he didn't go to college. He just went straight to the military and was dishonorably discharged because I think of drugs actually, but he was kind of wild.
All right. So I'm just taking shorthand notes about your family now. We're going to go into a little bit more detail on your next visit when you come, okay?
Yeah,
Uh, as far as legal history, do you have any previous legal history, like arrests or any charges?
no,
Any current legal history?
no.
All right, let's see. We're going to do what's called a review of systems. So I'm basically going to ask you about your body and see if you have any problems that you need to address right now. Okay. So, any problems with your skin?
No.
Okay. Any problems with your head, your ears, neck, throat?
No, I used to get, sore throats all the time. When I had my tonsil, I don't have that anymore.
All right, that's good. Any problems with your heart,
I don't think so.
your lungs,
No.
your liver or kidney?
No.
Mm-hmm. Any problems with your vision or with mm,
I probably should wear glasses, to help me read. Sometimes I'm at work, I have to squint to look at stuff if it's kind of dark, but other than that, yeah, I think I'm good.
you have any dizziness or drowsiness or loss of balance?
No.
Mhm. Let's see. Now I'm going to go over some psychiatric symptoms, and I want you to, these are just kind of generalized questions that I have to ask to see if we can identify um, more specifically what's going on with you. Okay.
Okay.
So you said that you've been feeling down. You've had some low energy. Have you had any trouble sleeping?
Well, yeah, I feel like the turning off piano doesn't really keep me asleep. Like I'll wake up some nights in the middle of the night, and sometimes I wake up in the morning and I don't feel like I got any sleep at all.
Okay. Is it hard going back to sleep when you wake up?
Yeah.
All right. Have you ever felt what we call euphoric, where you feel very great? Maybe that you feel like you're on top of the world, nothing can touch you. Do you take um, random sudden trips out of state, or have you ever spent a lot of money just all of a sudden without any planning?
No, that doesn't sound like me.
Okay. Have you ever seen something that may not have been there, or hear something that may not have been there, commonly called hallucinations?
I mean, one time, like back in college, I used to smoke more, like when I was really high. One time, not other than that, no.
So that was kind of like an isolated occurrence where something happened to you. Can you describe that just a little bit more?
I don't know. It's just weird. Like me and a couple of my buddies, we were smoking like all day. And then I that night I felt like there were people watching me, even though like I was just in my bed by myself. It was weird. I don't know. I like felt like there were shadows or like I don't know. It's just strange. I just fell asleep. So,
Okay. So after that experience, do you have that feeling again where you feel like people are watching you, or maybe people are out to get you?
I never had it again since then. Like I said, I don't really smoke that much anymore. So
Do you ever
no,
feel like billboards are kind of set up for you to tell you secret information that other people can't
no,
understand?
I'm not crazy like that.
Um, I'm I'm not saying anybody's crazy, just gotta ask these questions. Um, have you ever had what's called a panic attack? So maybe you felt like, um, commonly it's like your heart beating very fast, you get kind of short of breath and have to breathe heavy. Um, you can feel like this impending doom.
Sometimes I get when I get really shitty day at work, or like I just start thinking about like wanting to go back and get my degree. I feel kind of like a failure, and I get a little bit worked up about it. I guess.
Okay, so do you spend a lot of time worrying about things that may not necessarily be in your control to worry about, or worry about things very often throughout the day that um, don't necessarily aren't fixing to necessarily happen?
Not all the time, but some days when I'm more down, I'll worry about stuff that I just can't do anything about right now.
Okay, let's see. So you never had a traumatic experience. Let's see. Do you find it hard to focus on tasks throughout the normal day? Do you see yourself starting a task maybe and not being able to finish it and doing that multiple times a day throughout the day?
No, I'm pretty good at getting my work done. That's kind of why I got promoted to assistant manager because I'm a good worker.
Okay. Uh, Have you ever cut back on eating so much to where you try to lose weight very rapidly, or have you ever eaten a lot of food and then purged it, so maybe you threw it up or exercised an abnormal amount?
No,
Mhm. Okay. So I think we're almost done. Thank you so much for staying with me and answering all these questions. I really do appreciate you coming and talking with me today. What I think we have going on is a little touch of depression, just exactly what you said verbatim. I think this happened a couple of times in your life. Uh, and I think we have a couple of things that we can do for you, okay? So, the number one thing is I think we should get you started on some medication. And I want to see how you do with Prozac. It's a medication that really does not have a lot of side effects, and I've seen it work in a lot of patients. All right, and
I've heard of that one.
it's
Yeah.
to kind of to settle your mood a little bit. Okay, so you don't have such downs. And I want you to stop taking the Tylenol PM, um, because it can start wearing on your liver because it has Tylenol in it, as the acetaminophen can wear on your Tylenol, especially if you don't take it as directed. So I don't want you to take that anymore. I want you to start taking something called trazodone.
Okay.
And trazodone is just a medication to help you sleep. I want you to take half of the pill um, at night, every night. The first night, it may not help as much as you think it should. Continue taking it. By the second or third night, you'll start resting peacefully. The first night, after you wake up, you might have a slight headache. Take some medication over the counter, some ibuprofen, Tylenol, whatever you have in your house, not the Tylenol PM because it's going to make you drowsy. And just call me if the headache persists, but I don't think it will. We're going to start you out at very low doses of both of these medications, and I really think they're going to help you out. Another thing that I want you to start trying to incorporate in your day is walking. Research says that if you have some exercise, walk 15 minutes twice a day, it can really have a great effect on your mental health. Um, and even if you don't feel like going outside for the day, even doing some brisk walking around your house or even around your yard, if you're feeling comfortable enough for that, can really help you.
Okay. I think I can do that.
All right, you ready for it? All right. And I think the last thing I want to start working on is the alcohol consumption. And I've kind of touched on this before, where the high risk drinkers can start to develop some signs and symptoms or this can start to develop some cancers. And alcohol is a depressant. So when you're feeling down, the alcohol can put you even further. Even though it may make you feel good in the moment, it can really dig down your mood. And it can work against the medication that you're going to take. I want to see you back in about 10 days. We'll make an appointment for you, and I want to do your family genogram just so that we can see some of the trends in your family and really start working out what's going on. All right.
Yeah, that sounds good.
All right. Perfect.
I have to keep taking like you call it Prozac, right?
Mm-hmm.
I have to keep taking it like forever, or is like can I stop taking it after a few months or a few weeks or something?
It's a great question. The Prozac, we really want to see the full effect, and the full effect is going to happen after 1 month. Um, After that 1 month to 6 weeks, 4 to 6 weeks, I want you to stay on it and stay with me for 6 months. And once we reach that 6 month goal, we can see where you are with your feelings, with your mood, and see what we can do about either getting you off of it or taking a vacation from it is what we call it. So stopping it for a couple weeks and putting you back on it. But right now, I really want us to work on increasing your mood, and the Prozac I really think is going to be very helpful in that.
Okay.
Thank you so much.
All right. Yeah, thanks.